I think, every avoidable death, every avoidable harm for people in our local community is something that we care deeply about.
So the medical risk of smoking hasn't changed. However, people are less aware of it because the harms are not as apparent in society at the moment.
People are less aware of the damage, not just to themselves, but to their families and their friends.
All tobacco is dangerous. It's the only legal product that, if used correctly, is designed to kill you. However, the illegal tobacco, you don't know what additional chemicals or contaminants are in there. The criminal organised gangs that deal with these, with this commodity, they know that it's so lucrative that they make so much money off the back of it. They're not going anywhere, and they're within our community. They're not going to worry about the sale of 20 cigarettes to someone who is 16 or a vape to someone who's 16.
The Director of Public Health report is a message to the local population about an important health issue. The Director of Public Health report looks at what's currently happening for our population around a particular issue, in this case tobacco, and then it sets out some ideas about what we need to do together to try and reduce that harm.
I see patients who are impacted by tobacco harm on a daily basis. The scale of tobacco harm is quite wide-ranging. It can be simple conditions such as gum disease and dental abscesses, and at the very other extreme it could be life-shortening in terms of cancer.
There's no doubt that tobacco means that people die early in North Somerset, and we see the harm presented in lots of ways every day, in our GP surgeries, in our hospitals, in our pharmacies, but also the impact on the quality of people's lives in everyday communities, and we can do something about it. We need to work together to try and support more people to stop smoking or to prevent them starting smoking in the first place.
It is really worrying and really concerning when someone loses their livelihood or their general quality of life due to smoking. As a medical doctor, it's quite saddening to see people go through these events in their lives, especially when there are so many things that we can do to help.
Change is definitely possible. This is preventable harm, but we need to get alongside people to help them to give up an addiction, and we need to try and do everything we can to stop people taking up the habit in the first place, so particularly our children and young people.